Welcome to Open BxRx Tuesday on BronxNet. I'm your host, Kibin Alleyne. I'd like to invite you to get social with us at BronxNet TV on Instagram and Twitter, and BronxNet Community Television on Facebook. What was once considered a rare virus is now a public health emergency in our country. In just a few months, monkeypox has become an imminent threat to public health, and now many are concerned about the effect this will have on members of the LGBTQ community. Joining me to discuss some misconceptions about the virus and the disproportionate impact the outbreak has had on the LGBTQ community is Dr. Wafaa El-Sadr of Columbia University. Doctor, thank you so much for joining me.
Thank you, my pleasure.
Now, can you first explain what is monkeypox or what monkeypox is?
Yes, certainly. I think monkeypox is a virus that we've known about for several decades, actually. It is not a new virus. So it's been reported, although in rare conditions, in several African countries in Central and West Africa. So it is what we have called an endemic virus that's been reported for years and years and years in small outbreaks in these African countries. Now, over the years, we've had very small, limited outbreaks of monkeypox infections in other countries around the world, but these have been limited in size and also limited to one specific location or another.
Now, I really like to know, how does it affect our bodies and our health?
Yes, I think the important to keep in mind that this virus is transmitted usually by what we call close physical contact, meaning close skin to skin contact. Somebody who, for example, touches the rash or the sores in somebody who does have monkeypox, and the infection is transmitted in that manner through skin to skin contact largely. That's what we know now. There may be other means of transmission. I can talk about that later on, but that's the major way of transmission. And then once the virus, the person is exposed, and if they become infected, then they develop some manifestations of the infection itself. This may be in the form of a fever, aches, pains, swollen glands, for example, in the neck or elsewhere. And then it's accompanied by the appearance of a rash and sores that look characteristic of monkeypox. Now, what we know is that for the majority of people who do get infected and do develop monkeypox, fortunately, it tends to be a self-limited infection. It tends to be not very severe, and usually people will recover on their own. But in a subset of individuals, they can have severe symptoms of monkeypox, including severe pain, and so on and so forth. And that then may require actual treatment to allay the symptoms as well as to treat the virus itself.
Now, since the start of the outbreak, or I guess since the outbreak started gaining some momentum, monkeypox has been linked to homosexuality. Can you just explain, why we were seeing that?
I think we have to be very careful not to say that this infection, monkeypox, is linked to homosexuality. We know, and certainly we've known for, and I always say this, viruses do not discriminate. Viruses are transmitted as viruses, and nobody is immune from an infection with a specific virus. So I think that's very important because we really want to avoid stigmatization of a specific population. What we've seen with this latest outbreak that's happening now globally in now more than 70 countries around the world, with large numbers of cases, much more than we used to see in the past, is that the population that appears to be most severely impacted at present are men who have sex with men. But that does not mean that others are immune from getting infected. Nonetheless, I think what we have to do now is to focus on the people most vulnerable to monkeypox and try to disseminate information so people can protect themselves, and also so that people who are at risk and may have a rash or a symptom that suggests monkeypox, that they immediately seek attention so diagnosis can be made and they can get the attention that they need.
Thank you so much for clarifying that, because there has been a lot of confusion about that. So I really appreciate you, setting the record straight on that. Now, there has also been some confusion around whether or not monkeypox is an STD or not. Can you tell us more about that?
Yeah, I think that's also something that we're learning. We don't know for sure whether this virus is a sexually transmitted infection, STI, or not. But what we know is that because, as I mentioned, it's transmitted through close skin to skin contact, that obviously can occur in any intimate setting, including during sex. So that is the reason that we've noticed that certainly people who've gotten the monkeypox infection appear to have had it through close contact, sexual contact with a person with monkeypox. And also, the other reason is that some of the rash that we've noticed in this current outbreak, the rash has been localized around the genital and anal area. So that's important for people to keep in mind so they don't mistake some of the rash from monkeypox with, for example, rash from syphilis or rash from herpes and so on.
Thank you so much for stating that because I wanted to talk about that a little bit more. How can you tell the difference? Because I know some people online are saying like even if they get like an acne or something like they just don't know how to tell the difference. How can people tell the difference and what should they look out for?
Well, I think in a lot of ways, this infection can mimic so many other entities and so many other infections. That's why I think I advise that someone develops a new rash, a new source, please go and get checked. It doesn't hurt. And there's a test that can be done that can demonstrate whether it's monkeypox or something else completely so that the person get the right treatments for the infection that they have. So I would say that have a high index of suspicion for any new rash, any new source, and go and seek attention with your primary care provider or a clinic that's nearby, so that you can, allay your anxiety and you can be sure that it is not monkeypox, because the rash can be can be characteristic, but it can also look like a pimple. It can be look like what you can see with other infections. The characteristic rash is one where you see a small vesicle, means like a bubble that contains fluid inside, and the fluid is pus. So these little pus containing rash is pretty characteristic of monkeypox. But nonetheless, we have seen rash with monkeypox that looks like a simple rash and does not look like the classic appearance. There also are people who don't manifest monkeypox by a skin rash, but rather they have ulcers in the mouth, or they may have ulcers around the anus or ulcers inside the rectum. So we have to be also aware if you have trouble swallowing, or you have pain in the mouth, or you have severe pain or ulcers around the anus or rectum, that this could be monkeypox. And please go and again seek attention.
Now, there has been an increased effort to make sure males in the LGBT community are protecting themselves, but this has been met with a mixed response. And as you mentioned, some are worried about the stigma that it can, just can come up with all of this. Can you just tell me a little bit more about that?
Yes, I do think that part of our responsibility, our collective responsibility, is to fight stigma and discrimination at all costs. I know, as someone who's practiced infectious disease for many, many decades, is that many infections, unfortunately, are associated with stigma and discrimination. And this is the last thing you want to do, because what happens is then that drives people to not seek the protection that they need. It may drive people from seeking the vaccines that we have at hand. It may drive people from trying to go and get a diagnosis done, or it may drive people from getting treatment that they need. So it's absolutely critical that we fight stigma and discrimination vigorously, because it is so vital to trying to stem the spread of this virus. So I think for the population that is now at highest risk, and I'm very careful to say at this point in time, because we don't know what's going to happen tomorrow, but the population that's at risk at this point in time, it's vitally important that, again, is to, if you're at risk and you belong to the LGBTQ community, particularly if you're a man having sex with men, is to please seek vaccination. We know that the vaccines are very promising and can hopefully protect someone from getting infection, and most importantly, probably can prevent from getting severe monkeypox infection. So seeking vaccination is very, very critical. And like I said, again, in addition, if you have anything that may look like monkeypox or you don't feel well, do seek care because there are tests that can make the diagnosis, and then you can be guided to getting the care that you need.
So, in our city, monkeypox vaccines are available. Can you just explain who is eligible for one at this time? Because I know there's also a lot of confusion around that.
Yes, vaccines are available. We're fortunate in New York City, although the supply is still limited. We have demand up here and we have a supply down here. So we are, and I'm hopeful that over the next week or so, we will see our supply increase so can meet the demand that we're seeing now in the community. So it's very reassuring that there's high demand for the vaccine. Um, who is eligible for the vaccines? There are priority groups, and I can list them. Number one is anyone who's had contact with a person with suspected or confirmed monkeypox. That's a very important priority. If you've had contact with someone with monkeypox, uh, you should seek vaccination as soon as possible. Ideally, within even 5 days of the contact is recommended. So that's number one. Number two, it's also recommended for other men who have sex with men who are at this point at risk for monkeypox, and they are eligible as well for getting vaccinated, particularly those who have had either anonymous or multiple sex partners in the past, 2 to 4 weeks or so. So those are the two priority populations for now, because of the supply shortage, the limited supply that we have at hand. So I would say I would encourage strongly people who fit into those categories to please make sure that you are at the front of the line when there are appointments available for getting vaccinated.
Now, can you quickly let us know for those who aren't eligible, how can they protect themselves against this virus?
I think that there are ways to protect oneself. I think, for example, if you are you know somebody who may have monkeypox, or you think has monkeypox, or they believe they have monkeypox, to try to please not have close contact with such an individual. That's really important, and by that I mean by touch, skin to skin. Any intimate or sexual relationship should be avoided with someone with suspected monkeypox. We also, as well, advise against sharing, for example, towels or bed sheets or clothes with someone who has suspected monkeypox or is confirmed with monkeypox. So those are the two ways that we think are important to avoid getting exposed to monkeypox and potentially getting infected with it.
All right, doctor, thank you so much for joining me.
Thank you. My pleasure.
We'll be right back with more Open BxRx Tuesday.